Hi, welcome to Nursing Manthra English question practice. Today we will discuss one question from Nursing Delegation. Question: the postpartum nurse receive reports on 4 mother-baby couplets. Which task can be delegated to unlicensed assistive personnel? Select all that apply. So here the task can delegate to UAP, unlicensed assistive personnel. SATA question. Option A, assisting the mother with morning hygiene. Option B, demonstrating neonate bathing technique. Option C, documenting intake and output on the mother. Option 4, evaluating caregiver interaction with the neonate. Option E, obtaining an axillary temperature on the neonate. Option F, swaddling the neonate after diaper changes. The answers are assisting the mother with morning hygiene. Option A, and option C, documenting IO chart, intake and output on the mother. Option E, obtaining an axillary temperature on the neonate. Option F, swaddling the neonate after diaper changes. So before going with the explanation, we can say which all are the scope of practice for RN. What is the scope of practice for LPN and LVN? What is the scope of practice for unlicensed assistive personnel? During my nursing delegation class, I have discussed all these details, but again, I will discuss here. Okay. So, the RN scope of practice. The RN is allowed to perform the clinical assessment. Initial, that means assessment has to do by the RN. Initial client education also has to do by the RN. Discharge education, compulsory RN only has to do the discharge education, initial education and discharge education. Clinical judgment has to do by the RN, and initiating blood transfusion has to do by the RN. Then IV medications, like that, so many roles are there for the RN. Then LPN or LVN, licensed practical nurse or licensed vocational nurse, they can monitor the RN findings, just monitoring the RN findings. After RN gives the initial client education, LPN or LVN can reinforce the education. Then routine procedures like catheterization or the procedures, they are practiced. That routine procedures they can do, dressing and all. Then most medication administrations they can perform. Ostomy care, then tube patency, enteral feeding, specific assessments also can be done by the LPN. Limited assessments like lung sounds, bowel sounds, neurovascular checks, these all are limited assessments. For unlicensed assistive personnel, which all are the activities they can perform? Activities of daily living, hygiene, linen change, routine or a stable vital signs checking, documenting intake and output chart, positioning, these all can be done by the unassistive personnel. So, assisting the clients with activities of daily living is within the scope of practice of unlicensed assistive personnel. Helping the mother with the morning hygiene, documenting intake and output, taking vital signs of a stable client, and swaddling the neonate may be delegated to the UAP. Registered nurses should follow the 5 right of delegation when planning the care. Then options 2, the RN assume responsibility for initial client teaching and a demonstration of the home care. Once the teaching and a demonstration are complete, the UAP can assist the mother with bathing the neonate. And option 4, the RN should assess the caregiver interaction with the newborn to identify any attachment issue is there or not. Elements of the nursing process, assessment, planning and evaluation, and a task requiring nursing judgment cannot be delegated. So that's why we didn't select evaluation, evaluating, demonstrating, like that options comes in the answer, means that is the role of the RN. Okay, so UAB or LPN, they are not demonstrating. Okay, demonstrating neonate bathing technique and evaluating caregiver interaction with the neonate, that should be done by the RN. So the registered nurse is responsible for any care requiring the clinical judgment. UAP can assist with the activities of daily living, documenting IO chart, positioning of the patient, taking vital signs of the stable clients. These all can be done by the UAP. I hope you understood clearly about nursing delegation and this question, why we have selected these options as correct.
Introducing the all-new Nursing Manthra NCLEX series, which contains question bank, which is including the new generation NCLEX question. Rationale followed by each question helps you to understand the question. The explanatory video collections with the help of illustrations and animation. Exam handbook, mock test and cheat sheets. Select your package now and get started. For more information about the subscription plans, you can